Dear God, we glorify you for all the blessings you have bestowed upon us. We are truly grateful for them. Thank you for allowing us today to meet and share our knowledge and time with one another virtually. May you send forth your divine wisdom to our speakers as they impart effectively their God-given gift to all of us. May they be blessed as they continue to share their expertise to the people who needs them. Bless the participants as well, so that they would be able to obtain vital information from this activity. May you send forth your Holy Spirit so that after this webinar, we may share what we learned in the spirit of your love and generosity, especially during these trying times. May we be able to bring glory to you, Lord, in everything that we do. Amen.
We will follow it with our Philippine National Anthem, the PMA hymn, and the Olongapo City Medical Society hymn.
Mga kababayan, ang pambansang awit ng Pilipinas.
Puso ko'y tingin ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay ang damdamin, suliranin itong baya'y pawiin. Idalangin natin ang tapat sa may kapal, ay lunas sa lahat. Awit ng DNA, tayo ay mag-iwan. Magtulungan, magunlad ng bayan. Ang kailangan, ibigay sa kanan, kalusugan at kasaganaan. Ang puso ko'y tigib ng kasayahan, dahil ako'y nasama sa tanan. Ang lahat may gintong nasa, makisig at masigla. Kapisanan ay tunay ang damdamin, suliranin itong baya'y pawiin. Idalangin natin ang tapat sa may kapal, may lunas sa lahat.
morning again. Now we would like to call on the President of the Olongapo City Medical Society, Dr. Raymond Joseph R. Manzo, for our opening remarks.
Thank you, Dr. Castillo, and a blessed holiday morning to everyone. Today marks our 10th lecture in the OCMS Cancer Awareness Advocacy, and this month we are celebrating childhood cancer awareness. One of the most common causes in delay in consultation for patients, especially for children, is not recognizing early signs and symptoms of any particular disease. This has a great impact in managing and treating illnesses, especially cancer. This has been the OCMS advocacy for this year. Impart knowledge to people, awareness of when to seek consult, and awareness that we can beat cancer. This morning, our guest speaker is a specialist in her field and our go-to doctor for childhood cancers. Let us all together learn from our expert this morning. Thank you and have a great long weekend ahead.
Thank you, Dr. Manzo. Our speaker for today finished her degree in Bachelor of Science in Psychology at the University of Santo Tomas, completed her degree in Doctor of Medicine at the Far Eastern University, Nicanor M. Memorial Foundation, and had her residency in pediatrics at the UP Philippine General Hospital. She continued with her fellowship in pediatric hematology and pediatric oncology at the University of the Philippines Philippine General Hospital, and has presented numerous case reports, including early bone marrow transplant in a patient with severe immunodeficiency syndrome disorder, second place at the Philippine Society of Hematology and Blood Transfusion Case Report Contest. She has also published research, including a randomized controlled study on the rise of oral agar supplementation in patients with neonatal hyperbilirubinemia, transfusion-associated screening markers among blood donors at the Philippine General Hospital, clinical pathologic profile of patients with neuroblastoma at the UP-PGH. She is a life member of the Philippine Medical Association, Bulacan Medical Society, a diplomate of the Philippine Pediatric Society, diplomate of the Philippine Society of Hematology and Blood Transfusion, diplomate of the Philippine Society of Pediatric Hematology, and fellow of the Philippine Society of Pediatric Oncology. Ladies and gentlemen, I present to you Dr. Marita Dra Mimay.
Okay na. Okay. Good morning po sa inyong lahat. First of all, I'd like to thank Olongapo City Medical Society for inviting me to give a talk on childhood cancer awareness. First of all, I asked Dr. Joseph, what kind of audience are we targeting in this conference? And he said initially, high school students po. So when I thought of the audience, I told him, di ba it would be better to talk on cigarette smoking, alcohol use, kung mga high school students ang topic natin for them. But since cancer is daw ang advocacy ng OCMS, kaya even if ito ang target audience nila, we can still talk about in children. So I must admit at first I was hesitant because of, and it will be if I accept the invitation, it would mean that I will have to sacrifice my very precious 48 hours of stay in Bulacan with my loved ones. And it's even Valentine's Day. There are many activities. And sabi ko, it will be difficult for me to accept the case the invitation right away. So Dr. Joseph said that he volunteered that he'll be the one to present this conference, and then I'll just be giving him some materials. So that's the plan initially. But when I saw the invitation last Tuesday, and it said there that it will be open to medical and non-medical people, I changed my mind and I decided to accept the invitation. Even it will take me just 72 hours to finish this presentation. It's primarily because I don't want to miss this opportunity to educate the people, the family, relatives, of children affected with cancer, and most especially those in the medical field, the frontliners in the local health centers, especially the nurses, midwives, and even in the hospitals like our interns, clerks, residents, and even in our private practice as family physician, who most of the time are the ones who are seeing and evaluating these children with cancer for the first time. So I also want to emphasize the early recognitions of the signs and symptoms of childhood cancer so that prompt referral can be given, earlier diagnosis, and treatment to be given to these children for us to attain better survival and even cure. So for my disclosure, first of all, it has been said by Dr. Joseph, I am not a member of OCMS. I am a lifetime member of PMA Bulacan Medical Society chapter. And I am also a PPS Bulacan chapter member, but it is also under the PPS Central Luzon chapter. Okay. Again, thank you to OCMS for inviting me in this conference. Start. Saan? Page. Share screen. Okay. Oh, to. Yan. So the objectives of today's presentation are to know the epidemiology of childhood cancer. The objective of today's presentation are to know the epidemiology of childhood cancer. Number two is to know the how childhood cancer differs from adult cancer, and to understand the common presentation of childhood cancer. First of all, from this slide, we can see that childhood cancer is a rare disease. Pag nakita natin, most of the cases are breast, lung, prostate, which are predominantly adult cancer. And in childhood malignancies, it only accounts for about 1% of all malignancies. Another important point is that most childhood cancers are curable. So an example of this is your ALL or acute lymphocytic leukemia, wherein the survival goes up. From the time in the 1960s, there was about 3% survival rate, but because of modern chemotherapeutic agents and treatment modalities and safe for these children, at this point around in the 89 to 96, around 82% of them are curable. So another very important point to remember is that timely diagnosis is extremely important and have better prognosis as well as diminished intensity of treatment. So how does pediatric cancer different from cancer? So in adults, most of the affected organs are the lungs, colon, breast, and prostate. But in children, the top three cancers are your lymphomas, and other cancers like sarcomas, soft tissue, and bone sarcomas. So in the pie chart, we see that predominant cancers in children, number one of which is your leukemia, the blue part, followed by your brain tumors and your lymphoma. And then part of the pie shows other childhood cancers like your neuroblastoma, soft tissue sarcomas, your kidneys, bone tumors, and retinoblastoma. So, sa Philippines, we don't have cancers. Most of the data are from big institution because of the funding, but the society is still working on it. And so far, this figure is the only latest incidence of childhood cancer in the Filipino children that has been included in the International Incidence of Childhood Cancer in 2017. And if we analyze the top three types of cancer is also similar to other countries in the world, like your leukemia, CNS tumors, and lymphoma. So, incidence pattern by age. So, adults, mapansin natin na as the adult increase in age, there's a greater chance of having cancer. But in children, we can see two peaks. So, early childhood and another peak during their adolescence. So, this table shows the type of cancer in children versus at specific ages. So, it will be easy for us to narrow down ano bang mga type ng cancer pag ganitong age mo nakuha yung pasyente. So during the first year of life, it will be neuroblastoma, Wilms, retino, rhabdo, medulloblastoma. But if the child is around 2 to 5, you also have other differential diagnoses like your embryonal tumors, leukemias, lymphomas, gliomas. And during the second peak, that is during puberty or after puberty, more common are your bone malignancies, lymphoma, gonadal germ cell tumors. So who are the children at risk? So those with genetic predisposition like Down syndrome, they are more prone to develop leukemia. Gardner syndrome, they are prone to hepatoblastoma. Of course, exposure to radiation or chemicals like your nuclear accidents and benzene. Benzene is more common in patients with AML. And very premature infants are also prone to develop hepatoblastoma. So infectious agents like those with HIV are also prone to develop lymphoma, sarcomas. Children infected with EBV, your Epstein-Barr virus, are also at risk with developing lymphomas. And surprisingly, even cancer survivors, those with ALL, can later on develop with secondary malignancy like your AML. Those exposed to cranial irradiation can have secondary CNS tumors. Even post-transplant patients, those receiving immunosuppressive therapy, can develop lymphoma later on. So this just shows some pictures. Those with genetic conditions prone to developing certain types of cancers. Environmental agents are also important, ionizing radiation. I've said the viruses, chemotherapy. So ito ang mga importante. What are the signs and symptoms that we have to recognize? Very important, number one is fever. So fever is seen in many forms of childhood illnesses, both benign and malignant. But it is also one of the manifestation of malignancy, particularly in leukemia and lymphoma. They can present with prolonged fever, your FUO or your fever of unknown origin, the differential diagnosis of which are your infectious causes, connective, and again, 10% of this may be malignancy. So when do you suspect if there's malignancy? If the fever is prolonged, more than 1 week or 2 weeks, and of course, there are other associated signs and symptoms like bone pain, weight loss, and there's pallor. Another frequent signs and symptoms of cancer is persistent lymphadenopathy. So normally in children, the nodes are really larger than adults. And this is because of this antigenic exposure, Lymphoid tissue increases in volume so that they are palpable during childhood. So in children, a nodal mass is not always an indicator for malignancy. More often, it is due to other causes. So hindi naman dapat lahat matakot. So what are the common causes of lymphadenopathy? So a big part of the pie, the white one, is due to a reactive hyperplasia. Then it's followed by the red one is your granulomatous diseases like your TB, and neoplasia accounts for 13%. So there are two types of pag may kulane. It can be secondary to a benign condition or malignant condition. So sa mga benign, it's used by infection like streptococcal tonsillitis, upper respiratory tract infection, viral infection, Kawasaki, toxoplasma like toxoplasmosis, rubella, roseola, Kachkas disease. So for malignancy, enlarged lymphoma, neuroblastoma, it might be part of your leukemia. If you want to assess lymphadenopathy, is it normal or abnormal? You have to take note of the size of the lymph nodes and also the location. So for the size, when do you say that yung kulane ay abnormal? So check the site. If it's located in the axillary or cervical area, it is abnormal if it is more than 1 centimeter. Epitrochlear, meaning dito po sa harapan ng tenga, di ba minsan napapalpate natin yung mga bata, may mga maliliit na kulane. If it is significant, pagka more than 0.5 cm. And then sa singit or inguinal area, common din po yan, lalo na yun sa mga batang mapapayat, di ba? Nakakakapatay ng mga kulani. But it is significant if the size is more than 1.5 centimeters. So sa location, supraclavicular may neck area sa may, ano ba yung ito? Sa ibabaw ng clavicle ng ating So pagka po sa left side, nakapa ang kulani, it most probably indicates an intra-abdominal disease. Kung sa right side po ang location, it is due to most probably an introthoracic disease. So when do you suspect kung yung pong kulani ay malignant? So ito po yung ating mga dapat alamin. If the lymph node is persistent and painless, kahit di po kulani, any bukol na lumalaki, secondly, your enlarged lymph node, location ng mass sa supraclavicular area, and of course, aside from the mass itself, meron po siya kasamang ibang signs and symptoms like fever, weight loss, fatigue, pruritus o pangangati, night sweats. So ito po yung mga pictures. Diba sobrang laki na kahit hindi mo siya kapain, nakikita na siya. So kailan po natin kailangan i-biopsy ang isang bukol? So we take note of the duration if it is chronic, persistent, progressive adenopathy, more than 6 weeks. So that's the magic number, more than 6 weeks. The size of the node. Any node which is more than 2.5 centimeter in diameter, in the absence of signs of infection that warrants antibiotics. Indication din po yan na i-biopsy yung kulani. Location. So supraclavicular. Most probably po may something po na problema dyan. So kailangan din po malaman kung anong nag-cause ng kulani na paglaki sa supraclavicular area. And again, very important are your systemic symptoms. So dapat i-monitor po ang weight ng bata. Siya ba'y nangangayayat? Siya ba ay parating naglalagnat? More than 1 week na, lagnat pa rin ng lagnat. At ang tiyan lumalaki kasi lumalaki ang liver and spleen. At kung nagko-complain po ang bata na masakit ang mga buto-buto, mga senyales po yan na sa kanyang kulani. So other indications, so kunyari sa chest x-ray po, may nakita na malaki po yung area ng shadow nung sa mediastinal area, tapos may anemia, at saka elevated ESR, pwede din pong i-biopsy, lymph node biopsy. So any persistent and painless mass that does not present. Kasi kung plain and simple infection po yun, ang cause ng paglaki ng kulani, mawawala thoracic masses. So, nandito na po tayo sa thorax. So, ang mga test po, may pwedeng mga primary tumor or mga metastatic like neuroblastoma, middle and posterior mediastinum o yung ating chest area. So, ito po ang mga laman ng ating anterior, posterior, and middle mediastinum. So sila po ang mga components mga organs na nandito sa area na to. So kung anterior and middle mediastinum po ang naapektuhan ng bukol, meron po tayong tinatawag na superior vena cava syndrome, dahil yung veins. So ano ang dapat tingnan sa bata? So distended ang neck veins, namamaga ang neck and face, nahirapang huminga, nawawalan ng malay, pati po ang mata, pwedeng parang maga. So meron din po tinatawag na superior mediastinal syndrome. Kung ang naipit naman po ay ating trachea, bronchus, daanan ng hangin. So pwedeng nagka-cough ang bata, hoarseness, wheezing, stridor, pwede nagko-complain ng chest pain, pwedeng magkaroon ng pericardial effusion or cardiac tamponade. So sa posterior part po, it's mostly due to cord compression. So there could be back pain, lower extremity pain, incontinence, or stridor from airway compression. So ito po ay table, ano pong mga type ng cancer, middle, posterior. So ito po yung tinatawag natin mga differential diagnosis na para mas madali tayong mag-guide kung anong pwede nating isipin sa location ng bukol. So in a table, pagka po bata, ito po mga common, it's usually neuroblastoma, teratoma, pagka newborn, pag infant, neuroblastoma, rhabdoteratoma, children, lymphoma, neuroblastoma, adolescent, lymphoma, Ewing sarcoma. So number 4, frequent sign and symptom, abdominal mass or paglaki ng tiyan. Palpable abdominal mass is one of the most common presenting findings of malignant solid tumors in children. Remember po na all abdominal masses requires workup. So, depende sa age, kung nakita mo siya during the neonatal period, most of them are congenital malformation coming from your GUT or GIT. Kung ang abdominal mass ay nakita mo kung 1 to 5 years ang bata, this is usually the peak of malignancy. So most of the common malignant tumors in the abdomen are your Wilms tumor and neuroblastoma. Kung older age group, adolescent, common sa kanila, lymphoma, inflammatory process, and of course, pwedeng benign condition. Yung pala pregnant yung bata. Akala natin bukol, lumalaki tiyan. Yung pala buntis ang bata. So pregnancy is always a consideration also if you are dealing with a female adolescent. So in a table, mas madaling intindihin, ito po yung mga common causes ng abdominal mass base sa edad ng bata. Okay, sa history, for abdominal mass, usually asymptomatic. Pag malaking-malaki na, tsaka lang tayo nakakakita ng mga simptomas, no? Kasi sobrang lumaki na yung bukol. There are associated constitutional signs and symptoms. Again, fever, kung malaki na yung bukol, pwede mag-complain ng pain, night sweats, at nangangayayat ang bata, lumalaki yung bukol. So in neonates, abdominal mass associated with prematurity, common ang hepatoblastoma or liver cancer sa prematures. Again, with infection, lymphoma, pagka EBV virus, pagka naman hepatitis, they are prone to develop hepatocellular carcinoma. And again, family history or Gardner syndrome, they can develop hepatoblastoma. So sa physical examination, kahit bukol siya sa tiyan, it should not be limited to the abdomen because there are other important signs and symptoms. Like may mga tumors, hindi lang bukol sa tiyan. So check for the eyes. Like for example, sa Wilms tumor, they can have eye changes like anerygia. Or sa katawan nila, there can be may hypertrophy or genitourinary tract malformation. So for neuroblastoma, they can present with subcutaneous nodules, or in the eyes, they can have periorbital ecchymosis or what you call your raccoon's eye. For hepatoblastoma, pwedeng may associated precocious puberty. So if you see a patient na may precocious puberty, you have to rule out if there's liver pathology like your or liver cancer like your hepatoblastoma. So again, this is a very nice table that will show you masses, whether malignant or benign conditions that affects the upper abdomen and mid-abdomen. So hindi naman po lahat ng bukol ay malignant. May mga benign cases lang din po. So yung mga bukol po sa tiyan, common is hepatoblastoma. This is the most common liver tumor in childhood. It accounts for 1 to 2% of childhood cancer. The mean age at diagnosis is 1 year old, but before 3 years old, 80% of them are already diagnosed. And around 40% of them advanced disease at presentation. So common symptoms, it could be an asymptomatic abdominal mass. Kung malaki-laki yung bata, there could be anorexia, pain, weight loss. Jaundice is rare. There could be thrombocytosis. And in all, so your hepatoblastoma can be seen in association with other diseases like your Beckwith-Wiedemann syndrome, isolated hemihypertrophy, familial adenosis polyposis, and also your prematurity. So another bukol sa po ay yung tinatawag na Wilms tumor na this arises from your embryonic renal precursor cells. So ito naman po ay bukol sa kidneys. It is the most common pediatric malignancy of the kidney. It is discovered by Sir Max Wilms. Ano po siya? German surgeon. We can see that the peak age at diagnosis is about 2 to 3 years old. And at around 5 years old, 80% of them has already been diagnosed. And Wilms tumor is also rare in infants. So they present as an asymptomatic mass in the flank. 25% meron siyang associated signs and symptoms like malay, pain, hematuria. So tinitingnan po yung ihi ng bata, kung parang pula-pula siya. So yung iba can present in around 25%, may hypertension, hemorrhage into the tumor, occasionally polycythemia or bleeding due to acquired von Willebrand's disease. So the third tumor po sa tiyan, yung tinatawag na neuroblastoma. So the origin is your primordial neural crest cells, which normally give rise to your adrenal medulla or yung pong organ na nasa ibabaw ng kidneys, and also your sympathetic ganglia. This tumor has the most varied clinical presentation. It can be primary, metastatic, or even your paraneoplastic syndromes. So ito po yung tinatawag na sympathetic chain, no, na affected ng neuroblastoma. Yung ano po, yung adrenal medulla, yung pong structure na maliit na sa ibabaw ng kidney. This is the most common extracranial tumor in infants. It occurs in about 36% pag less than 1 year old or 75% in less than 4 years old. Kaya lang po, the sad part about neuroblastoma is that about 75% of them, they are diagnosed metastatic na because probably of the location. Aside from the tumor itself, there are other systemic signs and symptoms that we have to be when we're thinking of neuroblastoma. So the constitutional signs and symptoms, systemic signs and symptoms. Again, your anorexia, weight loss, pallor, renal pain, irritability, and weakness. But very important are your eye signs. So you can have exophthalmos or yung parang nakaluwa yung mata. You can have periorbital hemorrhage or your raccoon's eye, parang nangingitim yung mata. It is due to the obstruction of your palpebral vessels, which are the branches of your ophthalmic and facial vessels by tumor tissue in and around the orbits. Kaya sila nangingitim. So there could be corner syndrome, your ptosis, meiosis, anhidrosis due to cervical sympathetic chain involvement. And in neuroblastoma, there's usually massive hepatomegaly. So in the abdomen, there could be constipation, localized back pain and weakness, scoliosis, bladder, anal sphincter dysfunction. May tinatawag din pong neonatal neuroblastoma and ito po yung picture ng baby, they usually use nodules. So, ang usual po sa kanila ay kung ng elevated urine VMA or your vanil mandelic acid. These are the primary unit metabolites of your catecholamines. Elevated po, may bukol, that plus at the same time, so by the tumor, then we can diagnose the patient as having neuroblastoma. So na 5-year CNS tumors, these are the second most common childhood malignancy. The anatomic constraints imposed by the rigid skull, the growth of an signs and symptoms like significant delay, and sometimes they are usually non-specific. So the cell of origin can be your glial, neural, or others, or combinations, your fossa, and the clinical presentation will also depend. Like in adults, the signs and age na po. For younger children, they can present as developmental delay or loss of milestone. So kung dati lang nag-deteriorate ang bata, so it could be older children, there could be deteriorating school performance and personality changes. Neuropathies, like your diabetes insipidus, hypothyroidism, precocious puberty. So ito po ang mga senyales na increase ang intracranial pressure or pressure sa loob ng utak dahil po sa epekto ng bukol. Na progressively worsening, nagsusuka po ang bata usually in the morning, irritable sila, papil edema, nakikita po yun sa fundoscopy pag sinisilip ang mata. But hindi po siya, it's usually rare pagka po less than 2 years old ang bata. Kasi po, yung head can still expand because of the open fontanelles. So they can complain of double vision because of 6 nerve palsy, head tilt. Sa infants naman po, yung bunan ay bulging. Pagka mataas na po ang pressure sa loob ng brain. So, supratentorial tumors are seen in about 50%, especially in those less than 6 years old. Yun namang supratentorial tumors po, more common for more than 8 years old. So the best method for screening tumor is by careful neurologic examination. 95% of patients with headache and brain tumor had abnormal neurology. So mga signs and symptoms po, pwedeng non-specific, headache, vomiting, visual disturbances, changes in behavior. Specific signs po, like kunyari, hemiparesis, mahina yung kalahati ng katawan, disturbances sa gait, visual field defect, o kaya nagsisisure. Kasi po yung mga headache, vomiting, pwede din pong makita yun sa ibang sakit. Like, kunyari, migraine. Diba? Common din yun sa kanila. So headache is a common symptom. If it is due to CNS tumor, hindi naman ganun ka-common. Pero kung ang karakteristik po ng headache ay inigising po ang bata sa sakit ng ulo, tulog, nagising ang bata, nagpo-complain masakit ang ulo, tapos kasama pa nagbamit, tapos yung may papil edema. So, pwede po tayo mag-suspect, baka may brain tumor. So, yan po. Picture lang po ito ng supratentorial tumors. Again, headache, enlarging head in the infants, focal neurologic deficits. Ito naman po infratentorial. So more of gait disturbances po. Tapos pwede sila magka-hydrocephalus, lumalaki yung ulo, weight and compression. So yan po yung mga physical examination. Okay. Neurospecific deficits. So ito po ay pwedeng makita pag sinilip na fundoscopy. Yung papil edema, mataas ang pressure sa loob ng mata. So ito po yung itsura ng hydrocephalus. So lumalaki po yung tawag dito. Obstructed po yung CSF flow, kaya po nagkakaroon ng hydrocephalus, yung ventricles. The child is often asymptomatic until a critical threshold is reached. So kung sobrang laki na po yung ventricles, doon po nagiging nagko-complain na po yung bata. So most commonly, kung may medulloblastoma, kung may bukol po, na can go very large even before detection. So again, to emphasize, ano po mga simptomas suggestive of a CNS tumor? So one is recurrent morning headache that awakens a child and changes in the quality, frequency, and pattern. So again, the magandang table, it tells us anong specific type of brain tumor at the specific age of the patient. So going to the extremities po, pwedeng knee or shoulder pain or swelling. So yun po yung musculoskeletal problems. Pain is a common symptom of childhood. So 1 out of 3, it can be the only symptom. Majority of severe pain can interfere with sleep. So bone pains can be seen in leukemia, lymphoma, neuroblastoma, even sarcoma. So depende po kung localized ang pain or diffuse ang pain. So kung localized, like kunyari osteosarcoma or bone tumors, intermittent pain that progresses associated with the mass. So, yun nga, common po sa mga osteosarcoma, Ewing sarcoma, Langerhans histiocytosis, or even primary bone, non-Hodgkin's lymphoma of the bone, localized. No? Pag multifocal or diffuse pain, usually disseminated yung type ng cancer, like leukemia, o kaya neuroblastoma, Ewing sarcoma, neuroblastoma that has metastasized to the bone, or Ewing sarcoma din. So, hindi naman po lahat ng pain ay secondary to inflammatory or benign conditions din po. So, like, kung meron po siyang signs of suppuration, it is usually fluctuant, erythematous, burn, extreme tenderness. So, other benign conditions are your soft cystic masses, slow-growing masses, and kung sa neonatal period, most often they are benign. For malignant tumors, they are usually rapidly enlarging, firm rubbery, hard mass. It is fixed to the underlying tissue and also the location in the supraclavicular area. So for the two common bone are your osteosarcoma, and symptoms are persistent pain. Usually sa adolescents sila nakikita. Sometimes na pagkakamalan pain is attributed to physical denial pa tayo. But we have to do prompt radiologic evaluation of the bone. Just so, ito po ang ating musculoskeletal connective tissue diseases like osteomyelitis. They may present as limp and arthritis, and most often, they may not always be seen. So, this is the table pag newborn, mga fibrosarcoma, pero as they grow older, you can already include rhabdo, Ewing sarcoma, osteosarcoma as part of your differential diagnosis. So next, the eyes. Retinoblastoma. It is a malignant tumor of the embryonal neural retina. It affects in children less than 5 years old. Pwede po siyang isang party lang, right? O parehas na right and left eye affected. It is hereditary in about 40% of cases. But most of them, 6%, wala pong family history. So there's intraocular growth of the tumor, there's invasion of the structures within the globe, and produce metastatic disease. This usually presents as leukocoria, or yung tinatawag ng white pupillary reflex, which is often first noticed when a red or well-child examination or in a flash photograph of the child. Ganito po itsura niyan, yung leukocoria, yung parang, yung tinatawag na matang pusa. No? Retinoblastoma, pwede po silang magkaroon ng strabismus or parang nagduduling. The child can also, parang pag malaki-laki na siya, can complain of decreased visual acuity. So, we have to observe your baby. Kung pag nakita nyo sila sa mga clinic, kung parang isang eye nagde-deviate, yan po yung strabismus, which is often the initial presenting complaint. And of course, your reflex, or ito po mas magandang picture, kitang-kita, puti yung isa. So itong sa ito ay comparison, no? Tingnan niyo po yung sa right, red orange reflex, but the other ones in more in that affected eye, white po yung kulay niya. So a simple fundoscopy, or yung fundoscopy is very helpful. So yan po yung itsura ng tumor sa loob ng mata, the white area. Again, strabismus, initial complaint. So sometimes there could be orbital inflammation, hyphemia, pupil irregularity, occurs with advancing disease. Inflammatory changes, hypema, so there's vitreous hemorrhage. So ito po yung retinoblastoma din, pero stage 3 to 4. Nakita niyo po na lumabas na yung mata sa mismong, ang laki-laki na nung bukol ng bata, no? Pati yung mata nakalabas, pati yung mga structures, lumaki na mas malaki pa yung bukol sa kanyang regular na mata. So eye symptoms, remember, they're common not only in retinoblastoma, but also in your neuroblastoma, your raccoon's eye, neuroblastoma, chloroma, in AML usually. They can also have proptosis. So, for common hematologic malignancy, yung pong first part natin, mga solid tumors, ito naman po ay blood diseases. So first, syempre ang ating popular, childhood leukemias. So very important, more than one abnormal hematopoietic lineage po ang affected, we suspect patient baka may leukemia. It means po, like kunyari, meron tayong CBC, mataas ang WBC, like this case, 33,000. Tapos, predominant po lymphocyte ang report. Kasi hindi naman po lahat nakakasabi ng lymphoblast, no? Pag regular CBC, basta bilog, they are reported as lymphocytes. And then makita nyo, anemic ang patient, 6.5 na lang hemoglobin niya. Platelet count is 40,000. So bagsak, 2 cell lines, elevated ang WBC. So CBC pa lang, pwede na tayo mag-suspect na baka may leukemia ang pasyente. So ito po ang importance ng CBC and differential count. You have a high WBC count in more than 50%, pero pwede din silang within normal limits or even mababa, like less than 5. Pag tinignan po sa peripheral blood smear, there can be blast cells. So, 2 cell lines, cytopenias, kunyari hemoglobin mababa, platelet mababa, no? O kaya neutrophil mababa, more of lymphocyte predominance. Kung isang cytopenia lang, kunyari, anemia lang, pwede din yun. Pero dapat may kasamang ibang signs and symptoms like may masakit na yung buto o ano. Hindi common anemic lang, hindi ka naman safe. You have to correlate. Kunwari, fever pala ng fever ang bata, daming infection. So, pwedeng na-catch mo lang early, kaya yun lang yung affected. And even in 1%, the CBC and diff count can be normal in 1%. So, very high index of suspicion para makatch mo sila very, very early. So, this is how lymphoblasts look like pag sinilip natin sa microscope. No? Mga bilog-bilog sila, white blood cells. So, sa bone marrow, ganit man itsura nila. So, for the etiology, as of now, parating but there have been several factors linking these factors to the development of leukemia. Like your ionizing radiation and very famous sa chemicals naman, benzene, they are correlating it with patients who develop AML. So drugs like your alkylating agents, ito very parang important thing to remember. Sa identical twins daw, if one twin develops leukemia during the first 5 years of life, the risk of second twin developing leukemia is around 20%. And they also have found out that in siblings of leukemic patients, they are 4 times more common to develop leukemia compared to the general population. So, may mga chromosomal abnormalities na also associated with the development. And famous of this is your trisomy 21 or your Down syndrome. So, yan. So, nung mga common general systemic effects of leukemia, they have fever, lassitude, ibig sabihin yung parang walang energy, parating pagod, no? Pallor, namumutla yung bata. So, ito, common symptoms of leukemia. Pag sinabi pong leukemia, wala pong staging yan compared sa solid tumor. Kasi po, pag sinabing leukemia, ang affected ay blood. So, ang ating dugo ay nasa buong katawan natin. So, from head to toe, affected po yan, di ba? So, for systemic symptoms, fever, weight loss, frequent infection, lungs na affected, the early shortness of breath, muscle weakness, masakit ang mga buto-buto, madaling mapagod, walang appetite, malalaki mga kulani, tapos ang tiyan lumalaki, may liver, spleen enlargement, night sweats, madaling mag-bleeding, bruising. Yan. Kita kayong ganito. More common, scleroma po, eye symptom yan, pero leukemia po sa mata, na nandun yung mga abnormal cells, common in AML. So pag chinek nyo po ang bibig, there could be leukemic infiltration of the gums. So ganito po itsura nila, yung mga severe types. No? Pero remember, hindi naman po lahat ng ganito ay leukemia right away. So we should also think of other conditions producing this, like if the child has intake of your anti-seizure medication, like valproic acid, basta yung anti-seizure meds, nakalimutan ko kung pinabagta. They can also cause gum infiltration. They can have frequent infection like your oral candidiasis. So sa skin, they can present with petechiae, maliliit na dat-dat, purpura mas malaki. So ito pala yung degrees of hematoma. Depends on the size of the Kung small pinpoint hematomas less than 3 millimeter, it's called petechiae. If it's about 1 centimeter, round shape, it's called purpura. Pag more than 3 cm, it's already called ecchymosis. And hematomas or bruises, synonymous sila. So ganyan. This is how petechiae look like, parang kagat na lamok sa layman, no? Tabi-tabi sila. Pero actually, it indicates a broken capillary blood vessel na may be a sign thrombocytopenia, mababa po ang platelet, no? Kaya nagtutuldok-tuldok na gano'n. So, purpura, mas malaki-laki po yan, no? Kasi yung size is about 0.3 to 1 centimeter. The bleeding is underneath the skin. They are red or purple in color that do not blanch on applying pressure. So, ito yung subcutaneous hematoma pag medyo mas malaki po, more than 1 cm. Also called bruise, and it's located both in the skin, sa extremities, and also check po yung ating oral area o oral mucosa. Pwede din po merong mga pasa-pasa sa loob ng bibig. So bone marrow infiltration, signs and symptoms. Pagka white blood cell ang ating bone marrow, pwede po tayo magkaroon ng anemia. So anemia manifested as pallor, namumutla, lethargy, dyspnea, pwede po magka-murmur kung sobrang baba na hemoglobin. May extra sound po, hemic murmur ang tawag. Hemic murmur, mabilis ang pagtibok ng puso. Pag bumaba po ang platelet, there can be bleeding, yun nga, yung petechiae purpura. Pagka bumaba ang neutrophils, they are prone to fever and infection. Pwede po mag-complain ng bata ng bone pain, parang iika-ika, ayaw lumakad, or eventually, minsan para silang napilay, hindi na talaga naglalakad. Kung extramedullary spread, ibig sabihin outside the marrow po epekto ng leukemia, ito naman yung makikita natin. So mga kulani, enlarge ang liver and spleen, pwedeng umuubo sila, nerve palsy, pati po yung testis, tinitingnan na, lalo na po kung pwedeng nakikita sa clinic, chinecheck po yung testis, kung enlarge sila. Pwede po kasi magtago yung mga leukemic cells sa testis, no? Skin lesions, gingival hypertrophy. Ayan. Ganyan po siya, yung gingival hypertrophy. And of course, fever of malignancy. O yan, liver and spleen, malaki. No? Pag pinalpate nyo, nakakapanay ng spleen. Tapos, on fundoscopy, meron siyang retinal hemorrhages kung may bleeding na. So, pwedeng involve po ang brain, no? Na increased intracranial pressure, can have hypothalamic syndrome, diabetes insipidus. Kung medyo malala, pwede nag-bleed na sa brain. Common in AML kasi sobrang taas ng WBC. So, pwede pong involve ang ating gastrointestinal tract. Bleeding is the most common manifestation. There can be nephritis. The cecum is the most common site of your necrotizing enteropathy. So again, testis, chinecheck po yung testis, painless enlargement of the testis, which occurs in about 10 to 23% of boys during the course of the disease. Ovaries can also be involved, pero very rare po, and there's priapism. There's involvement of the sacral nerve roots, mechanical obstruction of the corpus cavernosa and dorsal veins by leukemic cells. Even the kidneys are involved, so tinitingnan po kung may ihi ng dugo ang bata, is there hypertension, and there's renal failure. Sa bone, common po sa pain in about 25% of patients. It is due to direct leukemic infiltration of the periostrum. There could be bone infarction or expansion of the marrow cavity by leukemic cell. So kasi po yung bone marrow natin nasa buto. So pag maraming pong cells, nag-e-expand yun, kaya sumasakit yung buto. So sa baby naman po, most common are your skin involvement. More commonly seen, ganito po itsura nila sa mga AML or acute myelogenous leukemia. So, sa skin, pwede din po sila maapektuhan. Ang tawag dyan, leukemia cutis. So, paano sila dinadiagnose? You do bone marrow exam and biopsy. So, kumukuha po ng konting dugo natin. Dito sa yung bulalo na tinatawag, yun po yung ating chinecheck kung may abnormal cell tumubo. So, ganito po itsura nila, yung ALL, mga bilog-bilog silang ganyan. L1, L2, L3, sa dalawang types po ang leukemia, may ALL. Yung second po ay AML. So, mas malalaki silang mga bilog-bilog cells sa bone marrow. So, ang isa pa pong tinitingnan ay ang CNS involvement. Kung meron din pong kalat yung leukemia sa brain. So, chinecheck po using lumbar puncture, tinitingnan kung meron din pong mga lymphoblasts sa loob ng utak. Because CNS involvement is seen in about 10% of ALL and 5 to 10% of AML. So, other signs include cranial nerve palsy, headache, vomiting, papilledema. So, ano pong treatment? In general, ang number one po ay chemotherapy. So, very important po mag-chemo yung bata because with chemotherapy alone, curable naman po siya. Kaya lang, for a certain percentage of patients, kung late na po sila dinala, so mataas na yung white blood cell, so sometimes, or most of the time, hirap po silang pagalingin through chemotherapy alone. So ang alternative po natin yung tinatawag na bone marrow transplant. So simple lang po yun. Mas mahirap pa nga po ang donor kasi yung bone marrow na tinatawag ay na-harvest sa donor. Tapos, ibinibigay po sa pasyente, simple blood transfusion lang. So, ganun po ang simple explanation kung paano yung sinasabing bone marrow transplant. So, ang last po na cancer natin ay lymphoma. So, it originates in the lymphoid tissue. So, yung mga kulani. Naaral na natin kung anong normal at abnormal na kulani. So, dalawang types, Hodgkin's, non-Hodgkin's. So, pag Hodgkin's, kulani involving the head, the neck, and upper mediastinum. Pag non-Hodgkin, more diffuse sila. And Burkitt's lymphoma involving the abdomen and the pelvis. So, symptoms of lymphoma, painless swelling in the lymph node, neck, chest, abdomen. Pwede din may sore throat, fever, easy fatigability, weight loss, decreased appetite. Constitutional signs and symptoms, pare-parehas po. Night sweat, itching, frequent viral infection, difficulty of breathing, or fullness in the groin areas from nodes. So ito po mga itsura nila ng patients with Burkitt's lymphoma. Common po sila sa mga African children. Laki ng mga bukol sa face and even sa abdomen. A closer view of a child with facial Burkitt's lymphoma. So ang kulani, kahit maliit o malaki, importante po yan. Either kulani or mas bukol po yan. Importante po na investigate as soon as possible. Huwag na pong palakihin ng ganito bago tayo kumonsulta sa doktor. So even the soft palate, yung ating bibig, pag tiningnan, pwede din po merong lymphoma. Pag nag-x-ray, widen po ang mediastinum, pwedeng enlarge yung mga kulani. Sa singit, pinapalpate din po siya, pwede pong lumalaki din yung mga kulani sa singit. And the last sign of frequent sign and symptom of cancer in children, yung vaginal bleeding or mass. So in summary, when and how to evaluate signs and symptoms for cancer: fever, lasting more than 14 days, no identifiable cause. Basic, CBC with diphthong, pwede na yun. Vomiting, last longer than 7 days, no identifiable cause. Associated with headache during sleep, pwedeng head CT scan or abdominal CT scan. Pag constipation, prolonged more than 1 month, does not respond to conventional measure, you can do your abdominopelvic CT scan. Cough prolonged more than 2 weeks, no identifiable cause, chest x-ray. So bone and muscle pain. Pain is prolonged more than 2 weeks, no identifiable cause. You can do plain radiograph of the bone, CT scan, CBC. Headache occurs during sleep associated with neurologic signs and vomiting, occurs in the absence or family history of migraine. Baka brain tumor, you can do head CT scan. Hematuria, you have to evaluate immediately if hematuria is no identifiable cause, like your abdominal ultrasound. So anong main take-home points po to remember? Lay education on the early warning signs of malignancy may be strategic in improving health-seeking behavior and early detection of the disease. Prompt referral to the general clinics like our pediatrics, OB-GYN or surgery, and then to the pediatric hematology oncology service kung kailangan po, is also recommended for timely intervention. So ito po yung ating mga patients before. Ito po yung mga children with cancer. Ito po
some familiar faces.
You
You
see here, Dr. Jude Victoria, Dra Caseha. In front of him is Ralion, the only child of Dra Caseha. Siya po yung unang-una kong na-diagnose na may leukemia. Wala pa po akong 1 month sa Olongapo, kaya po ako na-stay dito. The only child of Dra Caseha, now already college na ata, no? Malaki na si Ralion. And then, ito yun. No, this one. Ito. Paano ko tuturo yun? That's Dayan. Niece po nila Dr. Ed Bongko, diagnosed with lymphoma. College na rin po ngayon. And another one, ito, tabi na in front of me, yung maliit na batang yun. Yan po si Hana. Pamangkin po nila Dr. Bustamante. Leukemia din po, college na po siya ngayon, o high school or college, no? So these are just proofs that cancer is curable in children, and they are living proofs of God's miracle on earth, no? Kasi buhay sila. Even if they have gone through difficult times, they're still alive. Other pictures, ito na po sila. Yan po ay dati, ito na po yung mga malaking bata. Ito po yung katabi ko po sa left, si Dayan. Yan po yung pamangkin nila Dr. Bongko. Yung sumunod po kay Dayan, yung nakaputi, ano po yan? 2 types of leukemia. Pati po itong nasa dulo. mixed phenotype, acute biphenotypic leukemia, college na rin po. Doon sa right ko, leukemia po din, taga-Bataan, si Jewel. And then ito pong pinakamatangkad, ano po yan, lymphoma, college na rin po. So these are proofs na naway sila if detected early. So yan po yung ating mga Christmas party. Kasama po ang Brave Kids and mga support group, cancer support group ng SOCFI, Subic Olongapo Cancer Foundation. Yan po. Yan po yung last namin na Christmas party ata. May mga clowns. It's nice to reminisce this Kaya lang because of the pandemic, wala po lahat. We cannot do it. Okay, that's it.
Thank you po, Doktora, for the very extensive lecture. So marami po kaming natutunan. No? Any questions sa ating audience regarding today's topic? No? You may raise your hand or type in your questions sa ating chat box. Mukhang naiintindihan nilang mabuti ang ating lecture for today. So anyway, no, based doon sa lecture ni Dra Mimay, no, so ang pinaka-important dyan is early detection. Early detection leads to early treatment. Early treatment, better survival. No? So kung mapapansin nyo, diniscuss ni Doktora ang pinaka-common na symptoms na nakikita sa mga batang may possible cancer. No? So may mga changes siya, bukol, abdomen, sa mata, no? Kahit yung mga simple na features ng symptoms of infection, no? So you have to consider at one point na possible, no, na cancer ang cause niya. So any questions po sa ating floor? Mukhang wala na po, no? So, before we end today's activity, no, I would like to, hold on. So, I would like to present, no, the certificate of appreciation present to Dra Marita Mimay for her valuable contribution as resource speaker for a lecture entitled Childhood Cancer Awareness Referral as part of the Society's Cancer Advocacy Lecture Series given this 25th of February in the year of our Lord 2022. Doktora, thank you very much po.
Thank you once again, OCMS, for inviting me. It's my pleasure and honor to give this lecture to the people of Olongapo.
Thank you, Dr.
Ayan. Thank you po. Reminders lang po, there will be another lecture for our cancer advocacy, this time about oral health and oral cancers. This will be on February 28, Monday, 6 in the evening. Hope you can join us there too. And finally, may I call on the Vice President of the Olongapo City Medical Society, Dr. Jerome Michael Acosta, for our closing remarks.
Hello, hello. Hello.
Ayun. Hello.
Naka-on ba yung camera ko? Parang hindi.
Yes, yes. Naka-on siya.
Okay. Okay. Magandang umaga. So yung lecture po ni Dr. It's very napaka-comprehensive, and I think any parent would have that as a nightmare, yung tipong ma-diagnose yung anak with any of the cancers na present ni Doktora. And I'm very thankful kay Dra Mimay and Dr. Joseph for presenting this lecture. Kasi yung pictures nga na pinakita niya, some of those kids talagang nabigyan ng fighting chance to survive because of these wonderful doctors, and they deserve recognition for that. So for all of those, ayan, nung syempre nung naging magulang na, parang nakakapraning, simpleng pasak, iniisip mo baka it's a blood neoplasm or what. So nakaka-nervous, no? Ng burdens pag magulang ka, nakakapraning. But then, ayan, buti nilang andyan sina Dr. Mimay at Dr. Joseph to make sure na okay ang lahat. And we are grateful for you, for the presentation. So, hopefully po, may natutunan tayo. At thank you. I know it's a holiday, panahon po ng pahinga ng ating mga estudyante na makapagpahinga, at thank you for spending your time with us. Hopefully may natutunan po tayong lahat, at stay for a while po and open po your cameras for the photo op. Happy holiday ba? Anong holiday natin ngayon? EDSA?
Happy holiday. Happy holiday, Eds.
It's a
Bukas ba yun ngayon?
At enjoy your long weekend po.
Okay, pa-open na lang po yung mga cameras.
Open cameras.